designated employee representative at your company, who handles drug and alcohol testing decisions and oversees your drug and alcohol program. So what we do here, of course, at Assure is ensure that your workers are fit for duty, workplaces are safe. We do that through drug and alcohol testing, OC health testing, training, and policy development. So your company's DER ultimately is the person who's overseeing your drug and alcohol policy, your drug and alcohol program. So typically, it's the positions that we typically see who takes this on would be the safety manager, HR, administrative assistant, your CEO, and company owners. So it doesn't have to be one of these. It could be anyone who's really going to dive in and take the time to fully understand your drug and alcohol testing policy and understand OHS requirements, understand the Canadian model for providing a safe workplace, and knowing, what do we do in shy bladder situations? What do we do if there's a refusal to test? So these are just the most common examples that we see. Doesn't have to be one of those. So the 6 responsibilities of a DER that we're going to walk through, here they are. So what are the responsibilities? What is this person? What is big picture? What are they responsible for? Managing your policy and your program. So each of you has a drug and alcohol policy, which most of us are aware of. But bigger than that, you've also got a program, and it might not be, spelled out specifically, and might not be, you might not have a document for this, but when I say program, it's just bigger than your policies. What do you do in each of the testing situations? What do you do when there's a refusal? Do you send for a SAP assessment? Your policy will speak to this, but if there is, somebody goes for a SAP assessment and they are on a return to duty agreement, that can be, a 6 or a 12-month agreement, could be longer than that. So the program would encompass all of that. And the DER is responsible to manage all of this. The DER number 2 coordinates the testing, receives results, removes employees from safety sensitive duties if required, refers people for substance abuse professional assessments, and oversees return to duty. So now let's unpack each of those specifically. So the DER, the designated employee responsibility, the point person for your policy, gets to be the one at your company who's knowledgeable about your company drug and alcohol policy. If there's somebody who's read it fully, even a couple of times, hopefully, it's the DER. You know that in these tests, your testing situations. That at our company, we do pre-employment testing, reasonable cause, post-incident, for example. And then in each one of those situations, the DER knows, do we do urine testing? Do we do oral fluid? Do we do breath alcohol? Or do we do a combination of all 3? So for example, the DER is the point person for us at Assure as well. And when we've got questions about a situation that comes up, you send an employee in for testing, and there's an issue, somebody tests positive or non-negative on a test, we're going to phone you and say, here's what's happened. How do you want us to proceed? What do you want the next steps to be? Number 4, do you do express testing? Do you do laboratory testing? So express meaning the instant drug test, we know results in our office within a few minutes, or do you send everything to the lab, or do you do a combination of both? What we're seeing a lot of companies doing is if they're continuing with urine drug testing, if you're doing a urine instant drug test and it's non-negative for THC, for example, what we're seeing a lot of companies do in that situation is immediately doing an oral fluid lab collection. So the DER is the person who's had these discussions with us, potentially with myself, with Carrie, our manager here, and talked through the pros and the cons of each testing, urine or oral fluid, of each of the options and each of the situations. You've had these discussions and decided what's best for your company in your situation. So another important part of the DER's role is to understand intimately the drug and alcohol testing process, what we do during a drug and alcohol collection, and how are you going to handle things at your company when things go not as planned. So most often, 95% of the time, employees come in, they're fully compliant with the testing processes. There's little to no issues, but sometimes there are issues. So the DR is the one who the collection facility, the technician is going to phone when there's an issue and ask, how do you want to proceed? So understanding the testing process, a bit of background is when you come in to provide a sample, if it's a urine collection and you're going to go into a secure washroom, you need to remove all outer clothing. So you can't wear a jacket, a hat, get to empty your pockets. You have to wash your hands prior to going into the secure washroom, and you get to wash after. You wash prior because detergents or liquids or contaminants can be put and dried on your fingers, and as a way to, and then put into the collection, stirred into your collection as a way to adulterate the sample. So another thing that we do is we're looking at urine temperature. So when urine comes out of our body, it's between 90 and 100 degrees Fahrenheit. And we need, as the collection technician, needs to read that temperature within 4 minutes after collection to ensure that it's within the acceptable temperature range. If it's outside of that temperature range, that's greater likelihood of substitution. So understanding that if there's, during the search or of the individual prior to going to the secure washroom, the technician, for example, notices that there is something large and unusual seeming to be in their sock. And when they are asked about it and asked to move it, it's a bottle filled with yellow liquid, for example. The technician is going to phone the DR and explain that and say, here's what's happened. How do you want us to proceed? Do you want us to stop testing? Do you want us to continue testing? So you're the person that gets to make these decisions. So what about shy bladder, shy lung, dry mouth? So if during the required window of collection for a urine test, an employee is not able to provide the minimum 45 milliliters sample that needs to go to the lab for testing, the DR again makes the decisions on what do we do next. So we here at Assure are going to advise you. We're going to advise you on best practice and say, best practice in the shy bladder situation. If they've been provided water, provided the required minimum 3 hours to get that sample, the next best practice is to refer them to a physician to look further into that, because most people with providing the amount of water that we provide within that time can provide the 45 mils. So shy lung, what if somebody's not able to provide a complete enough of a lung breath to get a breath alcohol reading, dry mouth for an oral fluid sample, or again, what do we do if there's a refusal to test? An employee is requested to complete a post-incident test, for example, they refuse. That would be called a refusal. If they've refused to comply with any of the testing process that the technician has requested of them, that is also deemed a refusal to test. So the DER makes decisions about what do we do next. So the DER is also responsible to coordinate testing. So you've set up an account with a drug and alcohol testing clinic like Assure. You've got all your testing details on file already. So when you set up your account, you got us the information that we know in pre-employment, we do urine panel 10 plus breath alcohol. For post-incident, we do oral fluid. These are just examples. So all of that is on file for you so that when any of your managers phone to request a test, if they don't know the details, that's okay. We've got it all on file. And best practice and a recommendation here would be if you're a company who's got you're working in multiple locations or multiple provinces, it's much easier to coordinate testing and much easier for your managers to know that there's one clinic that we phone and schedule with. There's one phone number to phone. There's one place that we get our results. We've got a relationship with one facility who's got multiple locations rather than we've got a relationship with 5 different ones, 5 phone numbers, 5 different ways of getting all of our results. So of course, here at Assure, we've got that. We've got over 200 partner clinics across Canada that we book your testing with. So coordinates the testing, so schedules the testing, and then ensures, an important piece is ensures all the managers are aware of how they can also schedule testing. So the DER doesn't schedule all the testing. You just have to make sure that the managers and supervisors also know we book with Assure. Here's their phone number, here's their email, and here's how we schedule with them. So coordinates the testing, and then you get the results. So when results come back, you've got the secure username and password to log online to view or download the results. You're the point person to get them. And there can be a couple of people at your company who get results. You also notify the employee of results and next steps. Some companies say, we want you to give a clean card, so we will give the results and they'll know the results before they leave our clinic. Some companies will say, please don't. Just give us please don't give results to the employees. Please just give them to us. We want to manage that. Whatever you prefer, we will honor that here. So the DR is also responsible to ensure that confidentiality is maintained, meaning only those who need to know the results get to know the results. Removing employees from duty is an important piece. So if somebody's non-compliant with the policy, they've tested positive on the test, there's been a refusal to test, that person needs to be removed from safety sensitive duties immediately. The DER is the one that's going to make sure it happens. If you don't do it yourself, you're delegating it to their supervisor to make sure that they remove them from duty. You get to coordinate, make sure that their shift is covered, that if you're moving them from duty, someone else might need to take over their duties. So you're going to make sure that's covered, make sure they've got a safe ride home. You're going to talk with HR, if you've got HR department or whoever that person might be, to talk about, are they going home on leave? Is this time off? Is this medical leave? Or is this with pay, without pay? You don't have to know all the answers, but you're making sure you're helping the employee find out the answers to this. And then, of course, you're going to document everything. Anything that the employee discusses, refusals, discussions with Assure, with the technician, making sure that everything is properly documented. Another important piece is referring for a substance abuse professional assessment. So the Canadian model for providing a safe workplace is considered best practice for drug and alcohol policies and testing and programs in Canada. What the Canadian model says is that there's 3 situations when an employee should be referred for a SAP assessment. If they've refused a test, tested positive, or if they've adulterated or substituted a test result. So refusal, a couple examples there, they refuse to participate in the collection procedures. Another example of refusal is you've requested a reasonable cause test. They've shown up to work. They were showing obvious signs of being intoxicated or hungover. You pulled them from duty. They requested a test. They refused. That's refusal. They're tested positive on a drug or alcohol test, or if they've adulterated or substituted. So substituted, they've brought in synthetic urine or somebody else's urine, for example, into the testing facility to try to substitute it for their own. Adulterated it, they've put something in the sample, in the urine sample, to try to adulterate it or alter it. Any of those situations, Canadian model says, immediately removed from duty, referred for SAP assessment. So the DER either has a direct relationship with a substance abuse professional, or you request that through us here at Assure. So we've got relationships with different substance abuse professionals who we've vetted, who understand workplace safety sensitive industry. They understand the nature of drug and alcohol testing in the safety sensitive industry, and they'll make an assessment, a determination about, is this person substance dependent, or maybe they abuse. Do they abuse, or are they dependent on substances? They're going to give you that diagnosis, that assessment, and then they're going to make treatment and return to duty recommendations to you. So then we turn that into a return to duty agreement that you would then complete with the employee. So either the DER has a direct relationship with the SAP, or you say, Assure, please make a referral for our employee to one of your SAPs, and we coordinate that for you. So then that SAP assessment is done, you get the report, and you decide on next steps. So the next steps is where the return to duty comes in. So the important piece of a SAP assessment is helping you as the DER, as the company understand, can we put this employee back to work in a safety sensitive position or not? They've just tested positive for cocaine, for example, on an oral fluid drug test. We need more information to as a company, you and that in that instance, you would need more information to know what do we do? How do we properly look after the safety of this employee, the safety of everybody at the company? How do we move forward? The SAP assessment gives you the answers to that questions. Here's how we move forward. Here's the treatment plan. So the substance abuse professional gives you recommendations that you then turn into a return to duty agreement. And we support you with that. We get we get the SAP assessment, and we actually create here at Assure, we actually create a draft return to duty agreement for you. We provide that to you. You can then, tweak it. It's just a draft, but we help you with, to get the ball rolling. Most companies just, kind of take it and use it as is, but of course it's yours. You're able to do whatever you like with it. But that return to the agreement then becomes what you would sit down with and discuss with the employee and essentially say, in order to return to you back to you, to potentially return you back to your safety sensitive position, here's the terms that you need to agree to abide by, the terms of this agreement. And they'll have some recommendations on there, such as I agree to complete a return to duty drug test prior to going back to work. I agree to go to 7 days of detox. I agree to attend 2 counseling sessions a month for the next 3 months. I agree to complete 6 unannounced drug tests over the next 12 months. These are just some examples of recommendations. So that's what the agreement would say. If the employee agrees with that, they would sign it and they could now start to complete those steps to return to work. If they choose not to sign that document, then they're essentially choosing not to return to a safety sensitive position. So the DER is the one who oversees all of this, making sure the SAP assessment happens. Again, you don't have to have a relationship with the SAP. You just need to make sure it happens. Phone Assure, we coordinate that directly with the employee. DR makes sure that once that's done, if you need to do return to duty testing, get that booked for them. And then another important piece is the DR is going to monitor compliance for the duration of the return to duty agreement. So return to duty agreement can last 6 to 12 months. So in order to, especially if, employees got a substance abuse dependency, so they're going to tell you, is it mild, moderate, or severe substance use dependency, or there's no substance use dependency. So if it's severe, for example, severe level of substance dependency, it's going to need a greater level of intervention and treatment to support them over the long term. So it's likely going to be a 12-month return to duty agreement. So over the next 12 months, the DER gets to support them and make sure that are they going to their counseling sessions that they said they would go to 2 a month for 3 months? Are they completing their follow-up testing, their unannounced testing, 6 unannounced over the next 12 months, if that's what it says? Did they go to detox? Did they complete it? So making sure that we're not getting a letter of completion, a certificate of completion from a inpatient treatment center, for example. And so again, over the term of that agreement, the DR makes sure that they are being compliant. And if they're not, then they're going to be the one that steps in and says, we need to pull this employee from safety sensitive duties again, and we maybe need to get them assessed again. So the DR oversees all of that. So that's kind of big picture what the DER's role is. So how can we, at Assure support you to excel as a DER? Our job, so a lot of what we do is just help you do your job better. And this is one of the ways that we do that is support you as in this role as a DER. So our desire is to be a partner with you. If you got questions about any of this process, that's what we're here for. So we're here to help you, with expert advice when you need it, whether it's OHS, understanding Alberta, SASC, BC, whatever province you're in, OHS, understanding the safety sensitive industry, the Canadian model. If you got questions about it, we're here to support you with it and understanding each of those things intimately. And we know that each of your companies and your needs and your industry is a little bit different. So let's talk about, should we do pre-employment testing? If we do, does oral fluid make more sense than urine? Let's have those conversations so that you're confident that this makes sense for you. Um, Especially around THC. Does it still make sense for us to do urine testing when it comes to THC, or should we be doing oral fluid? Um, so we can support you with, having somewhere to go if you need a SAP assessment. We've got vetted SAPs that we've worked with for years who get people in quickly, who do great work. You don't have to wait months to get in. We're usually waiting a day or two or three to get these assessments to happen. So they understand this industry. We all want things to happen quickly. Our SAPs get that. That's the only SAPs we work with are the ones that will get in quick. We offer you return to duty program support again over the span of that return to duty agreement. We offer compliance monitoring, so we will do that for you. If you say, I don't want to be the one following up with, did they go to their counseling session? Um, did they or did they not? They said they did, but did they really? So we offer compliance monitoring to ensure that they're staying in compliance with their agreement. And if it's not working for them, if there's a piece that's not working, we'll step in and support them with that. We offer supervisor training. So if things, the DER tends to be, one person who's in charge of this, but you need a team as well. You need your managers and supervisors to be trained to understand what do we do in a reasonable cause situations, post-incident situations. Do we test, not test? How do we properly document this? We offer that training. And of course, if drug and alcohol policy and program review, if you think it's time that we kind of had a sit down with our leadership and let's just walk through this, get a second set of eyes on it, we're happy to support you with that as well. So if you've got questions about any of this, contact info is there. You can email myself, John at Assure Testing, Carrie at assuretesting.com. Um, Call us. Happy to get to support you in any of your yeah, and help you excel and look great as a DER. So appreciate your time today. Thanks for being with us. Thanks for your patience with the audio. And we look forward to seeing you on the next one. All right. See y'all.